There is something happening in the brain long before any visible memory loss, a silent, slow process that causes no pain, gives no obvious warning, and is most often mistaken for normal aging. The problem is that by the time the forgetfulness finally appears, that process has typically been underway for more than a decade. And that is exactly why it is worth paying attention to signs that almost no one associates with the brain. Signs the body sends years in advance before any doctor makes a diagnosis of dementia, before the family notices anything wrong, before the person themselves is aware of any memory failure. One of those signs is in the nose. Another is in the way you walk. And there are others I will show throughout this video, including one that most people dismiss as simple absent-mindedness. I have spent years following studies and cases related to brain health and aging, and what stands out most in this field is exactly this. The most important signs arrive too early to be recognized. If you haven't subscribed to the channel yet, do it now. What happens inside the brain during this silent process involves a protein called beta amyloid. It begins to accumulate between neurons long before any visible symptom appears, interfering with the electrical communication between brain cells. Think of it as an invisible rust that gradually cuts the wires connecting one region of the brain to another. The process is slow, and it is precisely that slowness that allows physical signs to appear so early when the damage is still small but already underway. The area responsible for processing smell is among the first to be affected by this degeneration. That is why the loss of smell with no apparent cause like a cold or allergy deserves attention. Not being able to smell freshly brewed coffee, not noticing the scent of sour food, not recognizing a familiar perfume. These are subtle signs, easy to dismiss, but ones that science already identifies as possible early warning. It is not a diagnosis, but it is a signal the body is sending, and one worth bringing to a healthcare professional. The second sign is in the way you walk, and this may be the most overlooked of all. When the brain begins to lose connections, steps become shorter and more shuffled. The person seems to hesitate before each step, as if the signal between the brain and the feet is arriving with a delay. Many people attribute this to age, fatigue, or joint pain, and sometimes that is exactly what it is. But there is a difference between muscle weakness and the loss of neurological control over movement, and that difference is something a trained professional can identify with relative ease. And there is a third sign that almost no one connects to the brain: difficulty with fine motor movement, buttoning a shirt, fitting a key into a lock, holding a glass with precision. These automatic gestures depend on very specific brain circuits. When those circuits begin to be affected, the hand knows what it wants to do, but the signal arrives imprecise. The person tries, misses, tries again. And once more, this tends to be dismissed as something that comes with age, when in fact it may be something that deserves investigation. These three signs, smell, gait, and fine motor control, form the first group of warnings the body sends long before any visible movement. But there are others, some more physical, like the one I just described, others more subtle, involving behavior and spatial awareness, and one of them, which I will show next, surprises even those who are already familiar with the subject. There's a sign that seems simple at first glance, but that specialists consider one of the most revealing: asking the same question several times within a short period of time. This is not absent-mindedness. It is something different. The person asks, receives an answer, and minutes later asks again the exact same thing, with no memory of having asked before. This happens because the brain is failing to register new memory. Old memory may be completely intact. The person may recall events from decades ago with impressive detail, but what just happened simply did not get recorded. And that difference between preserved old memory and compromised recent memory is a very specific pattern that deserves attention. Another sign that appears at this stage is what could be called absurd disorder. Storing objects in places that make no logical sense, keys inside the refrigerator, the remote control in the clothes closet, glasses inside the oven. When this happens once, it is distraction. When it starts repeating frequently and the person cannot explain how the object ended up there, it is something different. The brain is losing the ability to register where things were placed, and at the same time making automatic decisions that have no objective logic. This is a sign that the family usually notices before the person themselves does. And then there is spatial disorientation. Getting lost on a route the person has traveled for decades, leaving the grocery store and not knowing which way they came from, turning onto a familiar street and feeling as though they have never been there. This goes beyond distraction or fatigue. It is the brain failing to access maps it built over years. And when this begins to happen frequently, it is a sign that should not be ignored. Now here's something important, because not every episode of forgetfulness is Alzheimer's. Not every mental confusion is dementia. And this needs to be said clearly, because the fear of a diagnosis leads many people to avoid precisely the evaluation that could bring relief. There's a vitamin deficiency that mimics the symptoms of Alzheimer's almost perfectly, and that can be corrected within a matter of weeks. Vitamin B12, when levels are very low, begins to destroy the protective sheath around the nerve. The result is mental confusion, memory lapses, difficulty concentrating, and mood changes. Symptoms that, without a simple blood test, can easily be mistaken for the early stages of dementia. And the good news is that, identified in time, B12 deficiency has a straightforward and effective treatment. The same applies to the thyroid, a gland that, when functioning far below what it should, can cause such intense mental slowness that it simulates dementia. Forgetfulness, slow thinking, difficulty finding words. All of this can be caused by severe hypothyroidism, and all of it can be reversed with the right treatment. That is why, before drawing any conclusions, a thorough medical evaluation is essential. A geriatric specialist or neurologist will know how to distinguish what is reversible from what is not. There is also something that modern science has been calling type 3 diabetes. The term may sound strange, but the idea behind it is quite concrete. Studies indicate that excess sugar in the body over time creates a state of insulin resistance that directly affects the brain. Neurons need insulin to function properly. When that communication is chronically impaired, the brain environment becomes more favorable to the accumulation of beta amyloid. In other words, what you eat over the years has a direct relationship with the risk of developing Alzheimer's. It is not a simple cause and effect relationship, but it is a real one supported by research and one that deserves to be taken seriously. This means that part of what happens in the brain is, at least partially, connected to choices we make every day. And that, far from being bad news, is actually the opposite. Because if there is a connection to lifestyle, there is also room to act. And that is exactly what I will talk about next, with 3 simple, science-backed habits that help the brain stay in better shape for longer. The last one is the most surprising, and it is probably the one fewest people practice consistently. Sleep is not a period of rest. It is a period of intense work. During deep sleep, the brain activates a cleaning system that removes metabolic waste accumulated throughout the day, including fragments of beta amyloid. It is as if there were an internal garbage truck that only operates when you are truly asleep. When sleep is chronically interrupted, shallow, or insufficient, that system cannot complete its work. And the waste that should have been removed stays. It accumulates. And over the years, that accumulation contributes to the environment that favors brain degeneration. Sleeping well is not a luxury. It is maintenance. The second habit involves what science calls neuroplasticity, which is the brain's ability to form new connections throughout life. And here's something many people do not know. The brain does not stop learning because it ages. It stops learning because it stops being challenged. When routine becomes completely automatic, when every day looks like the one before, the brain has no stimulus to create new connections. But when you learn something different, whether it is a craft, an instrument, a new route to work, or an app you have never used, you are literally building new wires in the brain. Those wires create redundancy. And redundancy means that even if some connections are affected, others can take over the function. That is a real form of protection. And then we come to the third habit, the most surprising one, and also the one most people resist changing: controlling sugar and refined carbohydrates. White bread, flour, processed pasta, industrialized sweets. These foods, consumed in excess over time, feed exactly the inflammatory process the brain fears most. The practical idea here is simple, though not easy: peel more and unwrap less. The closer food is to the form nature produced it in, the better it is for the brain. It is not about perfection. It is about consistency over time. These three habits, quality sleep, constant cognitive challenge, and sugar control, are not a cure. There are no promises of that here. But they are behaviors that science consistently associates with the preservation of brain health. And the difference between those who practice them and those who do not over the course of decades tends to be significant. Now, if you identified any of the signs mentioned throughout this video, whether in yourself or in someone close to you, the guidance is straightforward. Seek an evaluation from a geriatric specialist or neurologist without panic, without jumping to conclusions. Many of these signs have reversible causes, as we have seen, but only a professional can make that distinction safely. An early diagnosis, when necessary, opens a window of treatment that a late diagnosis simply does not offer. And that window can mean years of clarity, independence, and genuine presence in your own life. The brain sends warning through the nose, the legs, the hands, and behavior. The question is whether we are paying attention. And now you have enough information to do that more consciously. I want to ask you two questions before we finish. Have you ever noticed any of these signs in a family member or even in yourself without knowing what it could mean? And which of the three golden rule habits do you find hardest to maintain in practice? Leave your answer in the comments. I take every response seriously, and they help shape the direction of future content on this channel. If this video brought something useful to you, like it. Share it with someone who might benefit from this information, and if you have not subscribed to the channel yet, do it now. Every video here is designed to bring clarity on topics that truly matter for brain health and quality of life over time.